This module will address postoperative instructions. When you transition home the day of surgery, your coach or support person will drive you home and be with you overnight. You can be up walking with assistance, going to the bathroom, and doing stairs as instructed by the therapist. Be safe, take it easy, and pace yourself. Stay well hydrated and be careful to change positions from lying to sitting to standing slowly. Start the pain management as instructed by the discharge nurse, and start the CPM machine as soon as possible to prevent stiffness from developing. On postoperative day number 1, your dressing and drain will remain in place. If the drain falls out, do not worry, this is not a problem. Pace yourself, stay well hydrated and nourished. Continue the CPM machine. You will be seen by a home therapist who will help assure that you will acquire excellent range of motion, strength, and function. Continue with your schedule of medications. On postoperative day number 2, the drain will be removed by the visiting nurse. Make sure to hold pressure on the drain site for 5 to 10 minutes or until it stops leaking, and then cover the area with a bandage. Your dressing will be removed today, and you can leave your incision open to the air. You will be given dressings to place over the incision when you shower, which you can start 6 hours after the drain is removed. Your incision should be covered with dressings for 10 days while showering. Continue the CPM protocol, home exercises, pain management, and swelling control. In the subsequent days, you should continue with the pain medication regimen. You may taper off the stronger pain medications when you no longer need them. Please see our video on pain management for further details and instructions on this. Continue home exercises, swelling control, and CPM use. Continue with good hydration and nutrition, and try to resume as much of a normal sleep cycle as possible and nap if you feel tired. Your care team will provide a schedule for medications to take after surgery. This will take into account any allergies, intolerances, or potential medication interactions. Staying ahead of the pain is paramount to achieving your rehabilitation goals, and our multimodal program is designed to be taken on a fixed schedule. We will arrange a visiting nurse and therapist for the first 1 to 2 weeks after surgery. This person will check your vital signs and assess your surgical site. They will also work on home exercises and swelling control, and this provider can communicate any concerns to your care team. We'll now talk about the hemovac drain. A hemovac drain is used to remove fluids that build up in the knee after surgery. The hemovac drain is connected to a tube, one end of which is placed inside the knee during surgery. The other end comes out through a small hole in your skin called the drain site. How do I empty my hemovac drain? Empty the drain when it is about half full. Wash your hands with soap and water. Remove the plug from the top of the drain canister. Pour the fluid into a measuring cup. Put the plug back in without squeezing the canister. Make sure the tubing is not kinked or twisted, and refasten it to your clothes. Flush the fluid down the toilet and wash your hands again. A visiting nurse will remove the drain on postoperative day number 2. What happens if the drain comes out by accident? You shouldn't worry about this, it's not a major problem. Do not try to put the drain back in your knee if it comes out. Cover the drain site with a dry dressing and keep it dry for about 6 to 12 hours. What happens if the tube becomes disconnected from the drain canister? Clean the end of the tube with alcohol and reinsert it into the drain canister. Now we'll talk about the CPM machine. Stiffness is one of the most common complications following knee replacement and occurs early after surgery when the healing process starts and scar tissue forms. The CPM is designed to provide continuous motion to the knee for the first 2 weeks after surgery when the risk of stiffness is the highest. The idea is to never let the knee get stiff by moving it constantly while the healing begins. The machine will be delivered to your house prior to surgery and set up in the desired location, which is usually your bed. We recommend setting it to a range of -3 extension to 120 degrees of flexion and running it at a speed of 3. The Avatar protocol recommends 16 hours of use per day for the first 2 weeks, and this includes 8 hours at night during sleep and 2 hours on and off during the day. You may start the machine at a lower flexion degree to warm up the knee if you have been out of the machine for a while, but try to increase to 120 degrees as your knee loosens up. We have found that patients who are committed to using the machine according to our protocol have less pain, less swelling, and better motion at their 3-week follow-up visit. If you have problems with the machine, first contact SurgiCare at 1-888-291-8901. In terms of wound management, your incision will be closed with absorbable stitches and covered with steri strips or glue. There will be a dressing over the incision as well as an ACE bandage for compression. We do not use staples or any other type of suture that needs to be removed. We will now talk about swelling control. Swelling can act like glue for a knee replacement, causing increased pain and stiffness. Active swelling control is important immediately after surgery and on a regular schedule. Ice and elevation, or toes above the nose, are the best methods of swelling control. Elevation should be performed when not in the CPM machine also for about 30 minutes at a time. Ice can be used both in and out of the CPM machine and should be applied to the knee 30 minutes at a time several times daily. Place a cloth between the ice and skin to avoid frostbite. We recommend making ice bags with a 1-gallon Ziploc freezer bag, 1 cup of rubbing alcohol, and 3 cups of water. Make 3 to 4 bags so they can be exchanged when thawed. Elevation requires that you get your knees and toes above your heart. Elevating both legs is important as both legs can swell after surgery. Use several large pillows and set this up in advance of surgery. When you are not in the CPM machine, spend 30 minutes 2 to 3 times daily for the first 2 weeks elevating your legs. Daily exercise is critical after knee replacement to gain maximal range of motion. This does not happen automatically, but it takes motivation and grit. Frequent stretching exercises in both flexion and extension are key to try to achieve a functional range of motion. Our goal is for patients to achieve a motion range from 0 to 130 degrees. It may take up to 3 to 4 months to get this full range, but the earlier patients achieve motion, the better, as scar tissue begins to set in with time. Outpatient therapy usually starts 1 to 2 weeks after surgery. Depending on which knee you had replaced and how your recovery is proceeding, you should expect to arrange transportation for the first few weeks. Consult with your care team about where you plan to attend outpatient therapy, as our office does recommend certain practices who are most familiar with our protocols and goals. Most patients will attend outpatient PT for 8 to 12 weeks after surgery to maximize range of motion and strength. Since you will only be attending outpatient therapy 2 to 3 days per week, it is essential that you perform daily exercises on the other days. Full recovery from a knee replacement can take up to a year as the healing process matures and patients continue to make gains in motion and strength. We highly recommend that our patients continue a maintenance exercise program that continues beyond the end of formal physical therapy. In terms of follow-up, we typically see patients back at 3 weeks, 3 months, and 1 year after surgery. At 3 weeks, if patients are not achieving sufficient range of motion, we will see them back at 6 weeks to determine if a manipulation under anesthesia is indicated. If you have any wound problems, such as redness, increased swelling, or drainage, we may request that you come in for a wound check at any time. In terms of return to activity, it is important to allow sufficient healing before returning to anything strenuous. In general, you should wait about 8 to 12 weeks before engaging in strenuous exercise to avoid injury to the soft tissues around the knee. The early focus should be on maximizing range of motion, while strengthening should be a controlled and gradual progression. Walking and biking are good early exercises which are low stress. Hiking, skiing, racket sports, or anything that requires significant joint loading, impact, or agility all require that patients are well healed and rehabilitated. Check with your care team about return to such activities.